Hey guys, Dr. Mike here. Let's go over a quick overview or review of one of the things we've been discussing in the clinic, or if this is new, how we approach this in the clinic. But this is dorsal scapular nerve entrapment, which is pretty fancy for my nerve pain right here is bugging me. This is a tricky one, not necessarily to treat, but to figure out what's going on. It's a little bit different than a muscle and joint, but it kind of often shows up that way. So we'll try to do, and hopefully we did, a really good job of looking at movements, digging into your history and figure out exactly what's going on. Because once you get this identified, it should be pretty straightforward. There's some ups and downs in this type of therapy and how you recover, but ultimately, like, we get you to a point where like this is manageable and it eventually melts away. So this is our blog on it at tangelohealth.com. You can check that out if you're a reader, but I'll dive into some anatomy here that we've gone over or will go over. Let's get right into it. So primarily speaking, this patient, or you coming in, you're experiencing neck and shoulder discomfort. You might even feel it go down the back of your shoulder blade. At worst, it's a big, painful breath behind your shoulder blade, but usually it's more like muscle tension, joint tension that I'm just rubbing and it's not going away. And that's very important. When the nerve is involved, nerves don't like to be rubbed and they don't like to be stretched. So that's often why, like, hey, I'm rubbing and stretching it. It feels good in the moment, but it comes right back. We're essentially just kind of picking the scab there. So one, let's stop doing that. And then two, let's figure out what we're going to do to get you moving forward, to calm things down, and make sure this goes away. So the anatomy here is, and what I'm looking at and what I'll dive into, I want to see how your upper, middle, and lower trap work together. So this is you reaching, this is you pulling, this is you pressing, general mechanics that integrate these structures. And here we are. We want a very balanced system. We want the upper, middle, and lower trap working together. But oftentimes we live in a world that pulls us forward. That's great. We have tension and tightness and pain, so we start protecting. So it's really common for this pattern to start taking over. The pattern is an upper trap dominant movement, and not good or bad, just dominant. You're using that muscle a lot. When that happens, rather than the shoulder blades kind of sitting nice and easy on your back, they get pulled and round forward. So what it does, it actually takes me out of my lower trap, which is fine, right? Until it's not. But if I can't access sometimes this middle lower trap, your lat here, you'll have more work up top. And then you'll start recruiting other structures. This is your rhomboid, and this is your levator. So if I can pull that picture up, just to dive in here. This rhomboid and levator, it goes with that upper middle back tension. This muscle goes up into your neck, so right into that area. All right, those guys start doing more work. And then we've said this, and we may have heard it. It was like, I just store my stress here, which is may be true, but often I tell people, like, you're just using those muscles a lot. And that's great. They're working. Let's just give them some help. Because a lot of times, if that's been prolonged, or if you get into a bad position, or it's just been happening a lot, you can see here, I hope, you have a nerve that goes right through, in, and or around those structures. Okay. Just another image here. That nerve can dive down behind that shoulder blade. So now we just treat it differently. All right, we're not rubbing it anymore. We're letting it breathe. Nerves are a little bit more sensitive, so that's where, like, didn't sleep well, ate something funny, work's driving me nuts, partner's driving me nuts, my neck's starting to talk to me. That's typically how nerves show up. So just being aware of that is nice. And then two, now our job is to develop strategies to calm things down. That's the tissue work, that's the joint mobilization, and then that's giving you strategy on the rehab floor to calm things down some more, but also integrate other systems. And now we're back to where we were. How do we get into this middle lower trap while we're pulling, while we're reaching, while we're doing work? How do we offload and create some relief during our day? And then we know when we do this, not only are we letting those structures breathe, we're letting the nerve calm down, but we're also developing other systems and habits. So that's really the difference of it goes away and then it stays away. There is one thing to, like, getting massage, getting adjustment, rubbing, stretching, but then it comes right back. We'll be talking about nerve sensitivities, how to mitigate those things. But eventually, if you're moving differently and developing other strategies and building a robust system, this is one that we see all the time, but we do really, really well with. This is our bread and butter when we're talking about nerve pain and spine pain into our shoulder and neck. So good job. I hope this is helpful. Hang in there. We got some work in front of us, but I anticipate some really good results here. So